AmeriHealth Caritas is proud to present In Reach, a new publication that spotlights important healthcare trends and innovations. Recently, we sat down with Danielle Brooks, Director of Health Equity at AmeriHealth Caritas, to further discuss some of the themes in her article, Healthcare in Context.
So you will hear the phrase cultural competency is quite a widely used term, but really in the industry there is a push to move closer to using the words of cultural responsiveness and cultural humility, which I think are the appropriate ways of looking at this field. Cultural competence really does mean a complete understanding of someone else's culture or community. And in reality, that's very difficult to do. Cultural responsiveness is the action. It's the action to get to competency. But it's more important because it really invokes a continuous learning, a continuous focus on making sure that we are learning and understanding and really engaging and responding to the communities, the patients, the individuals, and the people that we serve. So when we think about really trying to engage from that cultural responsiveness area and really trying to improve health equity, we really do want to foster and really engage in that responsiveness approach because it is important, again, as communities change, as communities grow, as interests change, as focus and desires or the demographics that we serve shift and change, it's really important to continue to be responsive to those needs. I often think that the barriers that exist in really achieving cultural responsiveness start with us. As humans, we all exist and we all have and perpetuate our own biases. This is often unconscious. It comes from the communities we're in, how we grew up, the media we consume, our beliefs and our patterns, and oftentimes those natural occurrences can serve as roadblocks. In American society, we are also impacted by systemic issues, both historical and present, that also impact our ability to achieve true cultural responsiveness. It's important for us to examine not only this history, but how it impacts now and how our respective biases may also perpetuate that. It's also okay to see color in our society. There's been a notion of color blindness as a positive attribute, but it's okay to see color. It's okay to respond to people in positive instances of respecting and celebrating culture and community and individuality. And through that lens, that culturally responsive lens, we can really begin to chip away at these systemic issues and make a more equitable society, not just in healthcare, but throughout the communities that we serve. Healthcare professionals can begin to harness a really strong and steeped cultural responsiveness approach in their care delivery by first just knowing your community. Understand the demographic needs of your communities. Look at the neighborhoods, understand those mechanisms, talk to the individuals. Communities and individuals know what they need, they know what they require, and they know what's missing. It's also important to just make sure that you continue to take classes and study and really look at professional resources to really understand not only those tools and tricks, but also to understand how you can begin to center your practice in a culturally responsive way. I think it's also important to make sure that you understand the language needs of your community and work to making sure that you have staff or competent translators there to make sure that those communication barriers are reduced. And finally, it is a long-term practice. Again, a culturally responsive approach is not something that can be achieved. It's a lifelong mission, and it really involves you understanding the communities that you serve and best work to support those needs. I, as someone who works in the health equity field and has made it my mission in life, I'm hopefully optimistic about the industry understanding the importance of this work and working to achieve it. However, health inequities and health disparities have been with us throughout the building of our system. And it's important, if we are to achieve this work, to make sure that it is embedded in all that we do. That is not an add-on, that is not an extra. It is a true component of all the quality, all the work, all the efforts that the healthcare industry puts forward. If we're going to achieve true quality of care, if we're going to begin to really make steps in improving our healthcare system through efficiencies, through quality, through safety, health equity is a critical component. I am hopeful that we move forward But in order to do that, we need to move forward together, providers, systems, and communities.